Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Men's Health. Introduction. Men and women have many of the same health problems, but they can affect men differently. Some health problems are more common in men or are exclusive to men. Many of the major health risks that men face, like colon cancer or heart disease, can be prevented or treated. Screening tests can find diseases early when they are easier to treat. It is important to have regular checkups and screenings. This program explains men's health. It includes information on preventing health threats and keeping your body healthy. Common health threats. The top health threats to men include cancer, chronic obstructive pulmonary disease or COPD, diabetes, heart disease, injuries and accidents, strokes. Cancer is a group of many diseases that begin in cells, which are the building blocks of the body. Normal cells in the body grow and die in a controlled way. Sometimes cells keep dividing and growing in an uncontrolled way. This causes an abnormal growth called a tumor. If the tumor invades nearby tissues and body parts, it is called a malignant tumor or cancer. Cancer cells spread to different parts of the body through blood vessels and lymph channels. Cancers in the body are given names depending on where the cancer started. Cancers that commonly affect men include prostate cancer, testicular cancer, colon and rectal cancer, lung cancer, skin cancer. Another health problem that can affect men is COPD. COPD stands for chronic obstructive pulmonary disease. It makes breathing difficult and gets worse over time. Smoking is the major cause of COPD. The lungs cannot be repaired once COPD has damaged them. In COPD, less air flows in and out of the airways. This may happen when the airways and air sacs cannot stretch and relax as easily. The airways make more mucus than usual, which can clog them. The walls between air sacs are destroyed. The walls of the airways become swollen. The airways can become irritated by tobacco, infections, and pollution. Diabetes is another disease that affects men's health. The disease makes it difficult for the cells of the body to get the glucose they need to make energy. Glucose comes from the foods you eat. Insulin is a hormone that helps the glucose get into your cells to give them energy. With type 1 diabetes, the body does not make insulin. With type 2 diabetes, the more common type, the body does not make or use insulin well. Heart disease is another health threat. The term heart disease includes several conditions affecting the heart and the blood vessels in the heart. The most common type of heart disease is coronary artery disease, or CAD. CAD is the narrowing or blockage of the blood vessels that supply blood to the heart itself. CAD happens slowly over time and is a major reason people have heart attacks. A man's risk of heart disease begins to rise greatly starting at age 45. A stroke happens when part of your brain does not get the blood it needs. Most often, a stroke is caused by a blood clot blocking a blood vessel that goes to the brain. If you have a stroke, some of your brain cells quickly begin to die. With fast treatment, a person who has a stroke may suffer little or no brain damage, but severe brain damage can cause paralysis, thinking problems, or death. Other common health threats to men are Alzheimer's disease, depression and suicide, influenza and pneumonia, kidney disease. Preventing health threats. The biggest threats to men's health are often preventable. This section covers some of the main ways you can stay healthy for life. Smoking and alcohol abuse can lead to painful and unwanted health conditions like lung cancer. Healthcare providers have resources for quitting smoking and limiting alcohol use. Car crashes can be fatal for you and others traveling on the road. Your risk of an accident goes up if you speed, don't wear a seatbelt, drive after taking medication that makes you drowsy, after drinking alcohol, or when you are tired. These all slow your reaction time. To prevent infections and illnesses, wash your hands with soap and water before you eat, after you go to the bathroom, and any other time they get dirty. Eat healthy by emphasizing fruits, vegetables, and other high-fiber foods, as well as lean protein and dairy products. Limit saturated fat, added sugar, and salt. Manage chronic conditions, such as diabetes or high blood pressure. Follow your healthcare provider's treatment recommendations. Staying at a healthy weight lowers your risk of many health problems. Stay active by walking, running, lifting weights, playing sports, or doing other forms of regular exercise. This helps with stress relief and weight management. Other ways to reduce stress include getting enough sleep, talking with friends and family about what's bothering you, doing restful activities such as bike riding, reading, or meditation. If you consistently feel negative emotions or have lost interest in activities you used to enjoy, you may be experiencing depression. Depression raises your risk of suicide. Getting treated can help you get back to your usual self again. If you have suicidal thoughts, call for emergency medical help or go to the nearest emergency room. Visit your healthcare provider for regular checkups and screenings. Screenings can detect problems before they cause symptoms. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Sexual health. During puberty, many males that are becoming sexually mature may not understand the changes they are experiencing. These bodily and hormonal changes are normal and happen in almost every male. While going through puberty, men may suffer from anxiety, confusion, misinformation from peers. Sexual problems are common and most are treatable. Premature ejaculation, for example, happens to many men. If this is a concern, your healthcare provider may suggest counseling, medications, or sexual techniques. Erectile dysfunction, also known as ED or impotence, is also common. It happens when a man often cannot get or keep an erection. As men get older, ED becomes more common, but ED is treatable with medicines or medical devices at any age. Testosterone is the most important male hormone. It helps maintain sex drive, sperm production, body hair, muscle tone, and bone density. Lower than normal levels of testosterone can affect a man's body and mood. A gradual decline in testosterone is normal in men as they get older, but it is not normal for healthy older men to have no interest in sex. Other signs of low testosterone include erection problems, increased breast size, hot flashes. Additional signs of low testosterone are problems with memory and concentration, mood problems like irritability and depression, smaller and softer testicles, loss of muscle strength and weakened bones. Sexually transmitted infections, or STIs, are also very common. An STI is an infection passed from person to person through sexual contact. You can get and pass STIs through vaginal, anal, or oral sex and through genital touching. Some ways to lower your risk of getting an STI or giving one to someone else include abstaining from having sex with only one uninfected partner who only has sex with you, using condoms correctly and every time you have sex, getting tested. Unprotected sex with a woman can also lead to an unplanned pregnancy. Talk with your sex partner about birth control methods before having sex. No matter what your age, talk to your healthcare provider if you have problems getting an erection, problems keeping an erection, less interest in sex, other problems that keep you or your partner from enjoying sex. When trying to have a child, some couples may face fertility problems. If your partner has not become pregnant after 1 year of frequent sex without birth control, talk to a healthcare provider specializing in fertility. They may be able to find the problem and treat it. Many men have problems with their prostate. The prostate helps make semen. The prostate sits around the urethra, or the tube that lets urine leave the body. In young men, the prostate is about as big as a walnut. As men age, it grows, but it can lead to problems if it gets too big. The older men get, the more common it is to have prostate problems such as benign prostatic hyperplasia, prostate cancer, prostatitis. Screening for prostate cancer is available for men in their 50s and 60s, or for younger men with a higher risk of cancer. Screening has risks and benefits. Talk with your healthcare provider about whether screening is right for you. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Many of the major health risks that men face, like colon cancer or heart disease, can be prevented or treated. Screening tests can find diseases early when they are easier to treat. It is important to have regular checkups and screenings. The top health threats to men include cancer, chronic obstructive pulmonary disease or COPD, diabetes, heart disease, injuries and accidents, strokes. Other common health threats to men are Alzheimer's disease, depression and suicide, influenza and pneumonia, kidney disease. The biggest threats to a man's health are often preventable. You can help prevent problems by not smoking or abusing alcohol, driving safely, managing chronic conditions like diabetes and high blood pressure, eating well and exercising, managing stress. Sexual problems in men are common. These include premature ejaculation, erectile dysfunction or ED, low testosterone, sexually transmitted infections or STIs, prostate problems. Getting treated for these and other conditions can improve your quality of life and well-being. Thank you for using Explain.